Hi, I will be doing the final exam, 15 questions for the end of my HERT paper. So starting off with the first question, explain 3 highlights of your people or community. African American girls from ages 12 to 17 in East Camden are a vulnerable population. All or most of these girls in this population that I have researched live in single-parent households, with about 83% of those households being led by mothers. This shows that there's a majority of mother-headed homes in the community. The economic experience is very challenging, with most families earning between only $28,000 to $32,000 annually. Also, about 75% of these families qualify for free or reduced lunch programs. Lastly, mental health concerns are very high, with many of these girls facing elevated risk of depression and anxiety due to socioeconomic factors and stressors, but oftentimes they're not receiving the care that they need. Question number 2, explain 3 highlights of the environment. East Camden has a deep history and community. One highlight is the strong community institutions such as schools, churches, and cultural centers. These places provide vital services and support. Another thing is the impact. Although the impact of gentrification in Camden has brought profits to the city, it has also led to displacement for many people in Camden. This area faces systematic health care limitations, including no hospitals in East Camden itself and the slower than average emergency response times. Unfortunately, this lack of accessible medical services can have detrimental results to this population. Next, explain 3 highlights of my health issue. The mental health crisis among Black adolescent girls in Camden deserves urgent attention. These youth experiencing disproportionately rates of high depression, anxiety, and suicide, on top of the strong Black women stereotype and racial microaggressions, meaning that not only do they have to fight the systems that were set against them, but they have to do it without complaining and a smile on their face. They face barriers to proper health care such as cost, stigma, and a huge lack of cultural competent providers in the area. Programs like Virtual Castle and the East Camden Mobile Mental Health Outreach Initiative are critical to closing these care gaps by providing trauma-informed accessible support in schools and homes. The top 3 researchers for my health issue are Dr. Michael A. Lindsay, Dr. Ferenza T. Salim, and Dr. Yolanda M. Seeley. Dr. Michelle A. Lindsay is known for his groundbreaking work on the youth suicide trends among African American adolescents. His research has been instrumental in raising national awareness about the alarming rates of self-harm and the deep mental disparities in this population. Dr. Ferenza T. Salim focuses on racial socialization and its influence on adolescent mental health, particularly within the communities of color. Her work highlights experiences of racial discrimination and how they can impact emotional well-being and the stresses that can be impacted with early intervention. Dr. Yolanda M. Seeley studies the parental perspective in assessing mental health services for children. Her research brings great attention to how there can be real-life barriers for families when it comes to face the need for culturally competent mental health care tailored to underserved communities. The colleges and universities that they are from, Dr. Lindsay is from New York, Dr. Salim is from University of Virginia, and Dr. Sally is from Florida A&M University. This intervention shows humility by meeting students in their own environments, such as their schools, where the mobile will be meeting them. Using culturally competent mental health professionals and integrating community voices into the program development, it acknowledges the community's lived experiences and avoids imposing a one-size-fits-all solution to this mental health crisis. 3 ways my intervention will benefit the community is it eliminates the huge travel barrier by bringing the mental health services to the students directly. It normalizes mental health care, reducing stigma in a culturally sensitive manner. And lastly, it strengthens community trust in health systems by involving local leaders and families. Can you provide information about the research supporting the effectiveness of my intervention? Programs like Pledge to Connect have shown that in-person navigation and local partnerships in the community improve mental health access and reduce ER visits. Research shows that school-based programs can significantly boost youth mental health and increase student engagement. Next question, question 9. How would you market to gain and retain participants? Marketing for this intervention will include school announcements such as posters and posted throughout the school, social media campaigns specifically to target the youth, and incentives like gift cards and transportation vouchers. Stakeholders like school administrators and community leaders would also help promote this participation. What is an appropriate evaluation process for your intervention? So I plan to use a mixed method approach for the evaluation process. This includes qualitative tools for mental health access and qualitative feedback for focus groups. Success indicators would include reductions in anxiety and depression, and increase in school attendance and self-help behavior, which means they would be able to reach out when they are in need of help. What is an appropriate upstream for this health issue? An upstream solution would include increasing state and federal investments in mental health education and prevention programs in underserved schools, like the schools in East Camden, as well as requiring culturally competent training for all licensed mental health professionals. One thing that I would do differently would be to start the stakeholder collaboration process a little bit earlier to ensure deep community integration. I also believe that having stakeholders see the severity of the issue in this community and have a before, and then being able to have the stakeholders see the results of the program after would help show that they're buying into an intervention that is for the betterment of the community and that it works. I believe that this would help improve participation and sustainability from the members of from the students as well as the stakeholders. Do I feel like an expert? I do, because I've spent a lot of time researching and analyzing the data to properly report on this issue. It was truly important to me to understand the context of this issue within East Camden. I understand the challenges that these girls face and how personalized interventions can make a difference. As a health educator, it was noticed that the main issue affecting my population and specifically designed a culturally relevant and evidence-based intervention. I worked to understand the root causes of the challenges they face, especially around mental health. From there, I created an intervention that relied on proven strategies, but also stayed true to the cultural experiences and realities of this population. And lastly, I intend to use this paper to spread awareness to people of this community, as I have close ties within the East Camden. I plan to show that there are ways to get help for those struggling with mental health, and that even when resources seem scarce, and that there is help out there for them. Thank you.